Next, we're going to measure the Mew Indicator Line, or in other words, the Hang Cosmetic Line, because one name is never enough. So what this measure is going to tell us is the relative position of the maxilla, and it will also give us information about the vertical growth of the face, meaning if the face is growing in a longer manner than is ideal and than what is normal. What you're going to do is take a measurement tool. So if you're at a myofunctional therapy clinic, they're going to use something like this. If you're at home, just use a ruler. And you're going to measure the distance between the tips of your top teeth here, or your central incisors, okay, to the tip of your nose. Specifically, the tip of your nose coming from your tragus. So this is your tragus, this little cartilage area. And if you follow that completely straight forward, you want to find the point on your nose that is furthest from the tragus. You're going to use that as your other point of measurement. So your measuring will look like this. Okay, and then you'll take that number, and then you want to compare it to the normative values. So if your child is 5 years old, the norm is 26 to 28 millimeters. Not just at that age, but as they age from there, you're going to add 1 millimeter per year until they get to puberty. Another way to calculate this would be taking your child's age and adding a specific number to it. So if you have a daughter, you're going to add 21 to their age, and that will give you the norm, the millimeter norm. If you have a son, you're going to add 23 to the child's age, and that will give you the normative value. If you are an adult, if you're an adult female, the norm would be 36 to 38 millimeters. If you're an adult male, the norm is 38 to 40 millimeters. Now, it's going to be very rare for you to get a number lower than that. It's very likely, at least in today's society, that your number is going to be higher than that. If you have a child who you're noticing has a larger number than the norm, I highly suggest finding a myofunctional therapist or an airway dentist or someone within that realm who can help assess your child in order to intervene sooner than later. Your child is growing, and there are signs that they're not growing their face in an ideal manner, meaning their face is growing more down and back than it is up and forward. This can have negative effects on the airway as well as sleep and just overall well-being related to, especially to those two realms. This could be caused by abnormal oral posture and movement, or just poor habits earlier in life. But the sooner you address it, the better, because you can actually impact them much more now than you could if you waited until they were done growing. If you're an adult and you're noticing this number is much larger than the norms, again, this is worth talking to a myofunctional therapist and or an airway dentist about, because they can look at your situation a little bit more in depth and help you determine what kind of individual treatment and intervention is going to be the most beneficial for you based on your goals. If you have any questions about the Mew Indicator Line, please write it in the comment section below, or find me at summerspt.com, or reach out to your local myofunctional therapist. If you'd like a full myofunctional therapy assessment form to use as you follow along and click through these videos, then go ahead and click the link below and enter your email address, and a full myofunctional therapy assessment form will be emailed to you.